Can I first of all say how sorry I am that I can't be with you today. I've got other things to do today which remind me of the kind of importance of the NHS, the importance of nursing and midwifery. I, together with a small gaggle of expectant parents, visited my local maternity hospital a couple of weeks ago. An extraordinary experience in all sorts of ways. We were led round by a midwife who, in my view, was absolutely fantastic. She gave a set of messages to some very nervous people which portrayed a real professionalism, a real understanding about the needs of the mothers involved, a real understanding of the kinds of worries that they had, which made the whole experience entirely positive. She took us around the labour suite, she explained all the things that would be happening, all those things that were there to help and support parents, explained in detail how mothers could make choice about the kinds of things that they wanted to see and the kind of experiences that they might have had. She gave that level of assurance and professionalism and competence that you want in a midwife when you're putting your future and your baby's future in their hands. Those people left that maternity unit, and I was one of them, with a great deal of confidence about the way in which the service would operate. It seems to me that in a nutshell gives you an idea about the importance and significance of the work that we all do to support and help frontline people provide the best service we can possibly have. And on that, I'd like to genuinely thank all of you today, nurse leaders, midwifery leaders, health visiting leaders, school nursing leaders across the system for the work that you do. Being a leader in the NHS is never easy. The complexity of the challenges that we have, the pressures on us, the amount of public scrutiny are all significant. But you have done a remarkable job over the last few years, not only in terms of dealing with the financial constraints that we work in, but also the way in which the media and the way in which some really difficult and high-profile problems that we have been talked about. Indeed, you could very easily in those circumstances see a nursing profession under pressure. And great leaders like yourselves are helping and supporting staff through those very difficult and challenging times. Thank you.
I think when you've got time pressures, that is very difficult, and it's really important that you don't cut corners, because certainly in this job there would always be the worry that you missed something, that you've misdiagnosed something, and that will be terrible. So you have to take as much time as is needed. But there again, you know, when you have 85 patients through in the morning, it is very difficult. You do feel very rushed, but at the same time you have to just try and keep calm and just do whatever is needed for the patient.
The NHS and the nursing profession are undoubtedly under pressure. We can see going forward that after several years of enormous growth of the workforce, and in particular the nursing workforce, over the next few years that workforce will not grow, and in some circumstances it will decline. So the importance of nurse leadership, the importance of managing that workforce in ever better ways is absolutely critical. The way we deploy nurses across the system needs to be well organised and using the best possible techniques that we can have to ensure that we can match the needs of our patients to the skills of our nurses. That is a great challenge, I think, for nurse leadership over the next period. We're also under pressure in relation to criticism of our ability to deliver care and compassion in wards and departments around the country. We all know that sometimes the services that we're responsible for do not meet the standards that we would wish. But we need to be relentless in our determination to root out poor practice, to make sure that those people who are not providing the best care are either developed and helped and supported, or have to leave the service. We have to be really clear about taking that forward. The role of nurse leadership in this is really, really important. But what nurses also need is a compelling vision for the future. What is the future going to be looking like? How can we instill the kind of culture, dynamism and inspiration that we need to make our nurses great in the coming years?
I do love the job, can't pretend not to. Love it. And it's wide, it's varied, it's everything from, and just vaccinating that child, ensuring that everybody's reached their status, but then that COPD patient who might be on 16 hours oxygen with an FEV1 in their boots, and they're struggling, and if you can help them, that feels good as well, isn't it? They're very pleased, any help at all. It's wide, it's varied. I don't think you could have a job that's more different.
Improving services for our patients is the most important thing that we do. And in order to lead the nursing profession over the next few years, we need to do many things, but two in particular. First of all, we need to make sure we appoint really good people to lead the nursing profession. I've done my part in that, in appointing Jane Cummings as the Chief Nursing Officer for England. We also know that the quality of nurse leadership that we have across the NHS at the moment is the best it's ever been. We can measure that and show that very clearly. But also we need to set the direction. We need to make it clear what it is we're trying to do. An important part of that is being really clear about the values and principles on which we want to take the NHS forward. That's why care, compassion, commitment, competence, communication and courage are so important going forward. They're the values and principles that connect with our people, that connect with frontline staff. In fact, they connect with staff much wider than nursing. And it's really important that in everything we do, we as leaders demonstrate those principles in practice. But we need to do lots of other things as well. We need to support nurses, we need to help them do their jobs better. I can absolutely tell you that the commissioning board is completely committed to this strategy, this sense of direction. We'll do everything that we can to create the environment by using the tools at our disposal to help nurses and support them give great care for their patients. And I'm sure I'm speaking on behalf of all of my colleagues leading national organisations that we want to get behind the nursing profession to make this vision a reality. Now, when you look around the room, and you should all look around the room now, there is not another room somewhere else full of people who are going to lead the nursing profession over the next 2 or 3 years. You're sat in this room. You've got to do it. Politicians and managers like myself can help and support, but it's nurses and nurse leadership that's going to make the real difference going forward. And I'm absolutely committed, both personally and as part of my organisation, to do everything that we can to support nurses, to help nurses, to provide an environment for nurses, to provide great services for our patients. Services that do great things both in terms of outcomes for our patients, but also their experience and the way in which they receive care.